the thing with sleep apnea is, the first thing to know about sleep apnea is it is shockingly common. It is very, very, very common. The most recent data I've seen estimates that about 1 out of 4 or 5 men over 30 probably has at least some sleep-related breathing issues, especially if their BMI is over 30. It's more like 50-50. It's really high. Women get it less often, but it's also shockingly common in women too. So it's shockingly common. It's so common that my threshold for screening for it is very low, especially among otherwise fit people, because the normal risk factors. So like as you gain weight, you get it more because it can crowd out your airway. Humans, by moving upright, we solved a lot of problems and we've gotten a lot of benefit from being upright. But it created a problem with us in that our tube now has a 90-degree angle in it. And if you're designing a pipe and you put a 90-degree angle kink in your hose, where is it going to start having problems? So like any mass, whether it's muscle or fat or whatever, any mass. I mean, there are people who look at MRIs of like tongue fat, like cheeks, like anything here, that whether even skinnier people with smaller airways, where it's a little more compressed. It's a vulnerability in the human physiology for breathing issues. And it's actually mostly fine in that you can have 4 or 5 breathing pauses per hour in the night and be in the normal range. It's actually, sleep apnea doesn't begin at 5 is mild, is the low end of mild. And it's not even until you get to 15 per hour that it starts becoming moderate. So many people who are in the mild range don't even have any symptoms and might not be causing any problems. We have a lot of flexibility in the system. And my guess is it's actually been common through history. It's just we've written it off as something else, especially in people that don't have those obvious signs. So what are some of those less than obvious signs? If I have a patient who comes in and they say, I fall asleep just fine. Actually, if I'm anything, I'm a little tired during the day, whatever. I fall asleep just fine, but then I wake up in the middle of the night because of stress. My stress wakes me up, and then I have a hard time falling back asleep. When I hear that, I think there's greater than 50-50 chance in my mind that was a respiratory event. Stress doesn't wake you up.